Yeah, so a very good evening to all of you. Very good evening, guys. Dr. Aprajita Das, Dr. Kanishka, Dr. Libra, Dr. Saurabh Basu, Dr. Gautami, and Aditya Agarwal. So, very good evening to all of you. So, we are here to discuss some important topics that are relevant for your examination point of view. And let me mute my system. Yes, Dr. Rosel, good evening. So, like I will give you a list of around 20-30 topics which I think are important for your exam. In my opinion, these topics are important. And again, there's no guarantee that 100% questions will be asked from these topics. This is just on the pattern of the last 5-year questions. So based on the last 5-year papers, we have just chalk out a list of topics which we think are important in pharmacology. So we'll give you that list. And also we are here and we have whole night with us. So in case you have any query, you want to discuss any topic here, you are always welcome because we people meet very rarely and it's nice to see you people here online. So in case you have any doubt, you want to discuss some topic in pharmacology, you can also discuss that. You can also uh, chat me on this YouTube session. So the YouTube chat box is open. So I'm there with you. Dr. Pratik has just joined us. Dr. Pratik Javaria. A very good evening to you. So let's start with topic number one. So guys, whenever we start this pharmacology revision, as as a dental student, I hope you must be knowing the most important topic for you people is antimicrobial, right? So antimicrobial is a very important topic because you people have to deal with antibiotics. So in pharmacology, if you ask me, sir, which topics are important? So I will say you just go and see your practice, right? So whatever drugs you people use actually in your practice. So those groups of drugs are most relevant for your exam. So one other topic is antimicrobial, which these people ask very frequently in your exam. And if we talk about this antimicrobials, there are 5 subtopics in antimicrobials. There are 5 subtopics in antimicrobial. One is antiviral. First is antiviral. Second is antifungal. One is antiviral. Second is antifungal. Third is antiprotozoal. Third is antiprotozoal. The fourth topic is antihelminth. Fourth topic is antihelminth. And the fifth topic is antibiotics. So there are total 5 topics: antiviral, antifungal, antiprotozoal, antihelminth, and antibiotics. Right? So guys, you must be knowing which virus is the most famous virus, all-time evergreen virus, very commonly seen all over the world. Yes, Dr. Swati Chaudhary has joined us. Jyoti Rana, Dr. Jasween Shine. Good evening. So in antiviral guys, even this year also you had got one question on HIV. So HIV drugs classification is important, right? So no need to go in their pharmacology. Just read the classification and the mechanism of action of drugs that we use for HIV. So drugs that we use for HIV, just read the classification and the mechanism of action. And this time they have asked you the treatment part. So this time they've asked you the treatment part. So I suggest you to go for the treatment of HIV, like which regimen we use for treatment as well as the post-exposure prophylaxis. So being as a dentist, guys, you may have got a needle prick injuries. You may have got the splash of blood while doing some procedure, and you people get exposed to get that kind of infected blood of the patient who is HIV positive patient, then which prophylaxis you have to take. So that's a post exposure prophylaxis, like what is a regimen that you have to use, and the treatment of HIV. So if anyone can answer over here, uh, what is a regimen of uh, HIV treatment? Because regimen is same for the treatment, regimen is same for the post exposure prophylaxis. If anyone has good memory, anyone can recall the regimen, that would be great here. So anyone? Okay, no answer, no problem at all, guys. I will tell you the answer. So whenever you get HIV in your life, you have to delete this HIV from your life. You know, you people have to delete this HIV from your life, because HIV is not the good thing that should occur to you. So you should delete HIV from your life, right? So here the D stands for dolutegravir. D stands for dolutegravir, L stands for lamivudine, and T stands for tenofovir. So we have three medicines: dolutegravir, lamivudine, and the tenofovir. So you have to delete HIV from your life, that is DLT, right? So this regimen we give. And for post-exposure prophylaxis, this is given only for 28 days. And for if you've got this HIV already, this you have to take lifetime. So if you are HIV positive, you have to take the regimen for lifetime. But if you have got an exposure of some patient, you have to take it for 28 days. And no, Aprajita, it's not Indinavir. This was the old regimen which you have mentioned. The regimen has been changed now. So Dr. Libra has answered it correctly. DLT is a regimen. D stands for dolutegravir. D stands for dolutegravir. L stands for lamivudine. L stands for lamivudine, and T stands for tenofovir. So tenofovir, lamivudine, dolutegravir is the latest regimen that our government recommend. It's a government guidelines that you have to use this regimen. And how to give this regimen, this is important. So you people have to read these particular things: the treatment of HIV and the post-exposure prophylaxis, when to start, what is the best time to start post-exposure prophylaxis, and how long you have to take the post-exposure prophylaxis. This is important. So anyone can answer. What is the best time to start post-exposure prophylaxis? What is the best time to start post-exposure prophylaxis? Like, assume you are doing a procedure, you are doing a dental extraction, and suddenly, while giving the local anesthetics or LA drug, you have got a needle stick injury. And later on, you come to know that patient is a truck driver and patient has a multiple sexual partners. So patient is a truck driver, patient has multiple sexual partner, and you have got a needle stick injury while doing a procedure in that patient. So, what is the best time to start the medicine? Yes. So, best is to start within 2 hours. Best to start within 2 hours. Maximum you can start in 72 hours. Maximum you can start in 72 hours. So, within 2 hours, best to start, but maximum you can start within 72 hours. Mostly, guys, what happens actually, the moment you will get a needle stick injury. So, obviously, guys, you get worried like, I have got a needle stick injury. Then you send your blood sample for the HIV testing, not your sample, patient sample. Then you send the patient sample for the HIV testing, because you come to know whether your patient is HIV positive and negative. So most of the time, report does not come in 2 hours. So if you send the patient blood sample and to know whether the patient is positive or negative, that will take time. So usually this 2 hour, this duration usually not very relevant in day-to-day practice, right? Now, if you're already working with HIV positive patient, you know you're working in a ward where all HIV patients are admitted, then you get an exposure, then in that case you can start within 2 hours. But generally what happens? Generally what happens? You don't have time. You don't have that 2 hours of time, because you send the sample first, report will come next day, then you can start the regimen if the patient is HIV positive. This is what we usually do. So best to start within 2 hours if possible. Maximum we can start up till 72 hours. Okay. Now, like if you want to take an extra edge, if you want to take an extra edge over your competitor, like in medical side, vertical transmission, like if a pregnant female is HIV positive, if the pregnant female is HIV positive, how you can reduce this vertical transmission from mother to newborn. So this can be read by you people in case you want to take an extra edge. But being as a dental surgeon, these things are not relevant when the female is pregnant. So you people don't deal with pregnancy. That's why this is not very relevant. But in case you want to read, this is the extra edge that can give you. Now, guys, after HIV, any other infection you can think of, any other virus you can think of that you can get with a blood contact. So with the contact of blood, guys, we people can get hepatitis B also. We people can get hepatitis B also. You should be knowing the drug of choice for hepatitis B is tenofovir. So tenofovir that we use for HIV also. It's also the first line drug for HIV, also used for hepatitis B. So this also you can get after the exposure with the blood of the patient. So this is also important to know, the drug of choice for hepatitis B as well as the drugs that we can use for hepatitis B. Now guys, after this hepatitis B and HIV, right? You people deal with herpes infection. So you must have seen the patients come to you with herpes on their lips. So patient can come to you with HSV1 infection. Mostly you people deal with HSV1, right? Medical side people deal with HSV2 also. But how to tackle HSV1, you should be knowing the drug of choice. So anyone would like to answer what is the drug of choice for herpes virus? Any patient? Uh, nahi, Dr. Aparajita, we cannot avoid vaginal delivery. If the baby has to come, baby will come. Right? ना? आने वाले को कोई नहीं रोक सका. So you cannot stop it if the mother will go to the labor pain. When the amniotic fluid have already come down, already have come out, then आने वाले को नहीं रोक पाओगे, वो तो आके रहेगा. So we cannot avoid cannot avoid. Yes, electively we can say like that way. Electively we can say we should avoid vaginal delivery, and cesarean is always better if electively we are going. There is a regimen, Prajita, that you have to read in vertical transmission, like which regimen we give to baby to avoid the infection. So that regimen I'm talking about. Yes, guys, acyclovir is a drug that we use in herpes. Acyclovir is a drug that we use in herpes. Now, the one virus which I think maybe asked this time is Mpox. So Mpox is one more infection that has spread in the community, right? So Mpox is more important in for your microbiology point of view, right? So for your microbiology point of view, this is more important. But so far, only one drug has got approval for monkeypox. Only one drug has got approval for monkeypox because this infection has recently been started, and WHO has declared this as an epidemic. WHO has declared this as an epidemic, and so far only one drug has got approval, that is tecovirimat. So it's a new medicine for monkeypox or mpox virus. So this is a new epidemic after corona. Corona is not an important topic because that virus is gone. So spend less time on COVID-19, give more time to HIV and hepatitis B, herpes virus, and mpox virus. Maximum, in case you want to read, influenza virus, swine flu. So these days, like in North India, this time there is an outbreak of swine flu. So swine flu is important for North Indian point of view. The drug name is oseltamivir. Oseltamivir is a drug that can be asked. So these are the important topics which you can correlate with your clinical practice, can be asked in your exam. Now, after this swine flu, monkeypox, herpes virus, hepatitis B, and HIV, these virus, if we talk about antifungals. Now, guys, you people deal with which fungal infection? Can you please tell me that is seen after that many cases have been seen after corona, right? So I have lost the contact with you people. Yes, now I've rejoined the YouTube videos, but I cannot see the video. I think the video is stuck somewhere. No problem. Uh, Antifungal mein guys, mucormycosis, because you people are dental surgeons, you people deal with this sinus and all, right? So mucormycosis is important, the black fungus. Black fungus is important and relevant for you. So you should be knowing the mucormycosis. And the second is oral candidiasis. Yes. The second is oral candidiasis. How to deal with oral candidiasis. This is important. So how to tackle this oral candidiasis? This is important. So can any one of you tell me the drug of choice? Can any one of you tell me the drug of choice for this? There is some problem at my end. Yes, now it is connected. Yes. Yes, for mucormycosis, we give liposomal amphotericin B. For mucormycosis, we give liposomal amphotericin B with posaconazole. So liposomal amphotericin B is a drug of choice. And for candidiasis, guys, how you tackle candidiasis? We discussed during our lecture also that oral candidiasis, first of all, we give the local antifungal like clotrimazole. So we give the local antifungal like clotrimazole or nystatin. And if this local antifungal like clotrimazole or nystatin not able to manage the disease, then we have to go for the systemic antifungal drug. And the systemic antifungal drug fluconazole. Fluconazole is a drug of choice. Yes, Doctor, clotrimazole is a better answer than nystatin, right? So clotrimazole is a better answer with the brand name of Candid. So clotrimazole has a better results and the better side effect profile than nystatin. So if you're thinking ki local mein you are supposed to mark nystatin, that would be wrong. Clotrimazole is the better option followed by nystatin. Then if it is not controlled, then you have to switch to fluconazole, which is overall the best medicine or best treatment for oral candidiasis. So according to me, these two topics are important being as a dental surgeon, right? So one drug is liposomal amphotericin B. Second is this fluconazole, that is an azole. So these medicines are azoles basically. So we have to deal with this azoles. Now let's move on to antiprotozoal. Now being as a dental surgeon, uh, in antiprotozoal, there is nothing important for you. You can skip this topic. The topic that comes under this is malaria. So malaria is not very important topic for your exam. You can skip this topic. But there is one anti-protozoal drug, metronidazole. Now you can take this metronidazole as an antibiotic as well as anti-protozoal. Totally depends upon you. You can take this metronidazole as an antibiotic or anti-protozoal. So this is very important for your exam. So metronidazole has both properties. It is an antibiotic as well as anti-protozoal. That's why this is important, because you people use this group of medicines, metronidazole. So this is very important for your exam. Like one of the infection of your uh, uh, for your dental relevant exam is like Vincent angina. So treatment of Vincent angina, you can use this metronidazole, right? You can have this infection of the soft tissue and acute necrotizing fasciitis. You can use metronidazole. So this is very important for the exam. Now, nothing important in antihelminth. You can leave this topic antihelminth. That is, albendazole is a drug. If that question comes to you, albendazole you have to leave, right? So antihelminth is not important. Antimalarials are not important. Metronidazole is ultimate important drug for your exam. So do not give up. Do not forget this topic. Then we have the antibiotics. Now antibiotics mein no, Dr. Prajita, malaria regimen, to these people are not asking in medical side also. So malaria regimen is not important. Malaria regimen is not important. Maximum you can read the names of few medicines like chloroquine, you can read artemisinin. Otherwise, antimalarials are not relevant. So you should skip that topic. There's no question in your exam in last 4 or 5 years. So antimalarials you can skip, right? In antibiotics, if we talk about now, everything is important in antibiotics for you. So first of all, you have to read the mechanism of action. Mechanism of action of antibiotic is very important. So each and every topic is in antibiotic is important. So antibiotics mechanism of action is important. Now it is also important to know for you which antibiotics are bactericidal, which antibiotics are bacteriostatic. This is also important. Third, the question that was asked this time in your exam, antibiotic combination. Like what will happen when you combine two group of antibiotics? What will happen when you combine two group of antibiotics? Like what will happen if you combine sidal with sidal, static with static? What will happen? So antibiotic combination topic is important. So mechanism of action is important. It's important to know which medicines are bacteriostatic or sidal antibiotics. Then antibiotic combinations are important, right? So guys, please tell me which antibiotic combination is avoided, which antibiotic combination is better, like which is avoided. Like I will write the three antibiotic combination: static, static, sidal, sidal, and one static plus sidal. So who will tell me which is irrational? Static, static, sidal, sidal, or static plus sidal? Which is irrational? Yes. Like this time they have asked you the synergism. This time they have asked you the drug potentiation, like they gave you the example of amoxiclav. So amoxiclav they have asked you. Amoxiclav is which type of combination? So amoxiclav is not a combination of two antibiotic. It's a different type of combination. We call it a drug potentiation and synergism. Yes. So we should avoid static with sidal. So static with sidal is avoided. We should combine static with static and sidal with sidal, right? Yes. So it's also important to know the time dependent killing and the concentration dependent killing. Also important to know which antibiotics follow time dependent killing, which antibiotics follow concentration dependent killing. So this time they have given you the metronidazole. So metronidazole this time they have given you. So metronidazole follow concentration dependent killing, right? So this time they have given you this medicine. So this is also important to know time dependent killing and the concentration dependent killing. Now, after that, they can ask you uh, the after this thing, they can ask you that thing. I mean, beta lactam antibiotics. So the antibiotics which are important for your exam are beta lactam antibiotics, Second is macrolide antibiotics. So beta-lactam antibiotics, macrolide antibiotics are important for you. And guys, there is a antibiotic linezolid. This is very frequently asked in your exam. So beta-lactams, macrolides, linezolid, fluoroquinolone, metronidazole. These are the 5 antibiotic groups which are important for your exam. The drugs that you can leave, like which are usually not asked. So aminoglycosides are not usually asked. Aminoglycosides are not usually asked in your exam. Sulfonamides. Sulfonamides are not usually asked in your exam. You can skip this topic. Vancomycin usually not asked in your exam. You can skip these type of medicines. Vancomycin, sulfonamide, aminoglycoside. You can save your time in this. But beta-lactam antibiotics, macrolides, linezolid, fluoroquinolone, metronidazole, these antibiotics are important, right? So this is for the antibiotics. This is how you have to approach this topic of antibiotic, right? Now, after this antimicrobial, you must be knowing the second topic which they can ask you would be the general pharma. So general pharma is a second topic which is important, right? So in general pharma, guys, one thing they will ask you is a drug trial, clinical trials, right? So how the drug is discovered, what are the various phase of clinical trials? What are the various phase of clinical trial? Like what happens in phase 1 clinical trial, what happens in phase 2 clinical trial, phase 3 clinical trial, right? Yes, Dr. Aprajita. See, I told you mechanism of action of all antibiotic is important. Classification, we call it. So vancomycin is a cell wall inhibitor that will come to know in mechanism of action. But I'm asking about the details. Like if you ask me indications, so indications for these antibiotics, you have to read the indications. Okay, indications, side effects, and pharmacokinetics. For these 5 groups, you have to read indications, side effects, and pharmacokinetics in detail. So your query कि vancomycin कहाँ cover होगा, तो vancomycin will be covered in mechanism of action. That's why I told you it's very important because it's also important in medical side. It's very important in medical side also. The alternate year they give you one antibiotic, they ask you this antibiotic act by which mechanism. Like this time in AIMS exam, medical side AIMS exam, they've asked how the linezolid act in the body. So how the linezolid act in the body, this time they have asked, right? Okay, in general pharma, okay guys, one thing I have left, sorry for that, in this, before starting general pharma, one topic I have left in antimicrobial, which is a different type of bacteria. So which bacteria guys we have skipped? That's the most common infection in India. So because Dr. Prajita has pointed out in between, that's why that thing comes in my mind. One bacteria which is very, very common infection in India, that is tuberculosis. So anti-tubercular drugs. Anti-tubercular drugs is very important topic again. So anti-tubercular drugs, especially the side effects. Medicines side effects are very important. So side effects of anti-tubercular drugs very important for your exam. Like they don't ask you the resistance. So do not read MDR TB. So do not read about the resistant TB. Do not read about the XDR TB. So always read, do not read the regimen of TB. Even the regimen of TB is not asked in the exam. So do not read the treatment part, only read the side effects. Side effects are very, very important. And we people have given you one table in which we have given you all the mechanism of action, side effects of anti-tubercular drug and how to deal with them. That also we have covered, right? Okay, now in general pharma, we have discussed already. In general pharma, clinical trials are important. They can ask you the clinical trials. Number 2, guys, there is a topic DRC, dose response curve. So dose response curve, this kind of curves that will tell you about the drug action. That will tell you about the drug action. So DRC is an important topic. So dose response curve, how to find out the competitive and non-competitive blocker, which drug is more potent, which drug is more efficacious. So DRC will give you the knowledge about the drug potency, drug efficacy. This will also tell you about the competitive and the non-competitive blocker. So DRC is important, clinical trials are important. And number 3 topic that can be asked in general pharma is types of receptor. So types of receptor and types of enzyme inhibition. So these 2 things they can ask you. So types of enzyme inhibition, types of receptor. Basically, this comes under the same topic. We call them drug targets. The topic is known as drug targets. So medicine target can be receptor, medicine target can be enzymes. So what are the various types of receptors we have in body? This is important. And what are the types of enzyme inhibition we have? Competitive enzyme inhibition, non-competitive enzyme inhibition. So types of enzyme inhibition, types of receptor, like which are nuclear receptors, which are cytoplasmic receptor, which are G protein receptor. So this is important. So in general pharma, three topics: clinical trials, TRC, types of receptors they can ask. Now after this general pharma, if you move on to the third topic that can be asked in your exam is local anesthetic drugs. So we have a peripheral nervous system. Peripheral nervous system is a topic where everything about local anesthetics. So each and everything is relevant in respect of local anesthetics. So everything is important for local anesthetics. Now there is a topic skeletal muscle relaxants. In skeletal muscle relaxants, only read mechanism of action and the antidotes. Only read mechanism of action and the antidotes of skeletal muscle relaxants. So local anesthetics, most important topic. I hope you understand. Local anesthetics, like types of local anesthetics, surface anesthesia, right? And what is the mechanism of action of local anesthetic? Each and everything is important here. Now in skeletal muscle relaxant, you have to just touch the topic, just read the mechanism of action and the antidotes that are used to reverse the action. That's it. It will hardly take 2 minutes for you. And in GA drugs, only read the IV GA drugs, right? No, but they can ask you inhalation drugs also. So GA drugs, they can ask you the basic thing, like very superficial, they can ask you. So very superficial, they can ask you, like mostly they ask you the propofol. So propofol, you can read, halothane, you can read, right? So IV general anesthetic drugs, you can read more. IV drug, you can read more than the inhalational anesthetic agents. IV drugs, you can read more than the inhalational agent. So this is what you can read in topic of GA, right? Now, after this peripheral nervous system, general pharma and antimicrobial, right? तो dental का pharmacology तो यहाँ पे end हो जाता है. Got it? Now come to the medical side. Now come to the medical side. No, Dr. Swati Chaudhary, half-life calculations they are not asking. Half-life calculations they are not asking. In general pharma, or you can consider it as a separate topic also. In general pharma, there is a topic of drug interaction. There is a topic of drug interaction. Although there is no separate topic that we teach in our class as drug interaction, but what is relevant to read in drug interaction is liver enzyme inducers, liver enzyme inhibitors. So you can basically, in our textbook, drug interaction is a separate chapter actually. So here if you want to include in general pharma, you can take it here, liver enzyme inducers and liver enzyme inhibitor. So if you remember the names of these medicines, which are liver enzyme inducers and inhibitors, that will give you the whole drug interaction of pharmacology. Like even the medical side, if you read only these topics, the enzyme inducers and inhibitors, so that will cover all drug interactions of pharmacology. That's why it is important to read liver enzyme inducers and inhibitors. Separately, enzyme names, not important. So enzyme names, you are not supposed to read. Enzymes ka detail, not supposed to read. Half-life numericals, not supposed to do. Right? These are not been asked in any exam. First order, zero order kinetics, nobody will ask you. First order, zero order kinetics, nobody asks you. These are the relevant topics. Now, after this PNS, like if you will ask me, sir, which other topics are important, then if we talk about autonomic system and the respiratory system, autonomic system and the respiratory system. So guys, only read the medical emergencies. So here you read the medical emergencies only. So read only the medical emergencies. I will mention which are the medical emergencies. Like this time there was three questions. This time there was three questions from ACLS algorithm. There are three questions from ACLS algorithm. I don't know why they have put so many questions on ACLS algorithm. Like how to treat bradycardia. So ACLS में we people treat bradycardia. We people treat PSVT. We people treat cardiac arrest. So This all three questions were there in the same exam. All three questions they have put this time in your exam. That is advanced cardiac life support algorithm. Advanced cardiac life support algorithm. And any doctor, not only guys you or medical student or anyone, like any human being should be knowing like how to manage these patients of PSVT, cardiac arrest and bradycardia. These are our advanced cardiac life support algorithm. Every doctor should be knowing at any time in his life how to control these three. That's why the three questions are asked this time in your NEET exam, and for all three are from ACLS algorithm. Now, apart from that, guys, you must be knowing anaphylactic shock. So one topic is anaphylactic shock, how to tackle allergic reaction, because patient may get allergic reactions when the patient is in dental chair. So anaphylactic shock, how to manage anaphylactic shock, this is also very important to know, right? Apart from that, there are some poisonings here. There are some poisonings and their antidotes. So in autonomic system, there are many poisonings, many antidotes are there. So poisonings and their antidote. For example, organophosphate poisoning is mentioned. Datura poisoning is mentioned. So Datura poisoning, organophosphate poisoning, patient can have the scorpion bite, patient can have the snake bite. So organophosphate poisoning, Datura poisoning, scorpion bite, snake bite, all these things are covered in autonomic system, right? Yes, mushroom poisoning, Aprajita, now they will not be asked. The reason is in India, we don't have the mushroom poisoning cases. Mushroom poisoning is more common in Europe. So maybe mushroom poisoning was asked in 1980s or 90s, but now mushroom poisoning will not be asked. So don't give time to mushroom poisoning. Concentrate on here. Organophosphate poisoning, Datura poisoning, scorpion bite, snake bite, atropine poisoning. So these kind of poisonings or the toxicities they can ask you and how to control them. Yes, Dr. Sweetie Mehta, antibiotics safe in liver disease and the renal disease. So that comes under the pharmacokinetic part. So these topics are relevant. I told you pharmacokinetics. So this is important, right? Okay, now in this autonomic nervous system, uh, or respiratory system, you have to read the treatment of acute bronchial asthma. So how to treat acute bronchial asthma? That is status asthmaticus. So how to treat acute bronchial asthma? That is status asthmaticus. This is also important. So status asthmaticus is important, right? And number five, the drugs which are important here for you people is adrenaline. So adrenaline is a very important drug for your exam. And the one more drug that is important for you is alpha blocker. Topic is alpha blocker, where the drug name is tamsulosin. So हाँ, so अल्फा ब्लॉकर एड्रिनलिन यस यहाँ पे स्मगलिंग में कोकेन आएगा कोकेन पॉइजनिंग सो कोकेन टॉक्सिसिटी इट इज कवर्ड अंडर ऑटोनॉमिक सिस्टम कोकेन टॉक्सिसिटी okay so these are the important topics in autonomic system the topics that you have to neglect being as a dental surgeon the topics would be the anti-glaucoma drugs so guys any drug related to eyes any drug that is related to eyes you people have to ignore. I don't know why, but you people spend a lot of time in studying the drugs of eyes, but they never ask these questions in your exam. So drugs relevant to your eyes are not important for your exam. So kindly ignore these topics, right? And also, yes, this topic you have to ignore in autonomic system because there are many drugs given in autonomic system which are related to eyes. This is for ANS and respiratory system. After that, guys, we have a topic we call it diuretics and cardiovascular system, that is kidney and CVS. So if we talk about this kidney and CVS topic, now in kidney and CVS topic, I hope you must be knowing the most important topic is antihypertensive drugs. So most important topic is antihypertensive drugs. So antihypertensive drug is the most important topic for you. Second, they can ask you maximum the diuretics site of action and the mechanism of action. They ask you diuretics, site of action, and mechanism of action. That's it. Guys, this is the topic where you can save a lot of time because in medical side, lot of questions are asked from CVS, right? And when you do the question bank, you find questions that are asked in medical exam and you people get diverted. So here you have to save your time. Save your time to not to read the drugs of CHF, not to read drugs of CHF, not to read drugs of arrhythmia. So ignoring the drugs of arrhythmia, ignoring the drugs of CHF, ignoring the drugs of even angina pectoris is not important. So read only antihypertensive drugs and maximum read the site of action and the mechanism of action of diuretics. This is the only thing that you people have to spend time here, right? So this is for the diuretics and CVS. Now after that, guys, we have a topic, central nervous system. And I hope you must be knowing in central nervous system which topic is most important. The topic is painkiller. You people have to deal with the pain. You people have to deal with the pain, and you should be knowing that which medicines are used as a painkiller. So medicines are opioids. So opioids, important topic. So they can be used as a painkiller. So what is the mechanism of action of opioids when they are using as a painkiller? When we use this medicine as a painkiller, what is the mechanism of action? And you should be knowing what is the antidote of choice. What is the antidote of choice for the opioid toxicity? What is the antidote of choice for opioid toxicity? So they are the wonderful painkillers, and being as a dentist, you people use opioids like anything. You people give tramadol, because even I remember my dentist gave me tramadol for my pain, tooth pain. So I still remember I got a lot of vomiting after having the tramadol, because opioids cause vomiting very frequently. You should be knowing the opioid side effects also, like what are the various issues that we can deal with opioids when we give as a painkiller, and how to tackle those side effects. Now, apart from opioids, guys, you people have to read basics about the anti-epileptic drugs. So you have to read about anti-epileptic drugs. Maximum, you have to read the side effects. Side effects of anti-epileptic medicine, and that is only sodium valproate, carbamazepine. So sodium valproate, carbamazepine, you have to read, right? Sodium valproate, carbamazepine, you have to read. Phenytoin, you have to read. So phenytoin, benzodiazepine. So these are the anti-epileptics that you people have to read. Sodium valproate, carbamazepine, phenytoin, benzodiazepine, side effects. And also in relation to anti-epileptics, you have to read about neuralgia. So treatment of neuralgia is very important, because neuralgia can be related to antidepressant drug also. Neuralgia can be related to antidepressant drug also, because in treatment of neuralgia, we use both anti-epileptics and antidepressants. So this is also a treatment of pain. So pain is very important for a dentist. Try to understand now. You people, patient mostly come to you with this complaint. I always remember I always call my dentist. I always remember. I always text my dentist whenever I have the pain. Otherwise, I don't call him, right? So pain is a big issue for you people. So neuralgia can occur, like trigeminal neuralgia can occur, right? Patient can have the uh, other type of diabetic neuralgia. Patient can have the post-herpetic neuralgia. You can see, right? So antidepressants can be used. Anti-epileptics can be used in relation to the neuralgia. You people have to cover. Plus, in antidepressants, you have to read only one group, SSRIs. Antidepressants, you have to read only one group, that is SSRIs, not beyond that. Now, antipsychotic usually not asked in your exam. So antipsychotic you can leave. The topic that you have to ignore is antipsychotic. So antipsychotic, I haven't seen any MCQ in your exam from antipsychotics. So this topic you can ignore. Even the bipolar disorder, they have not asked you in exam, right? And even the insomnia, treatment of insomnia, they have not asked in your exam, right? Even the drug de-addiction, the medicine that we use for drug de-addiction, these topic that you have to ignore. These topic that you have to ignore, right? So this is all about the list of important topics in central nervous system. Now, after the central nervous system, next topic is your favorite painkiller. So guys, if I say if the patient will have the pain, any drug that is given for the pain is important. So there is a group of medicines, we call them NSAIDs. The topic is autocoids. So NSAIDs are important, that is painkiller. Now we can also use opioids as a painkiller, that you have to read. We also use anti-epileptic drugs as a painkiller for neuralgia, that you have to read. In antidepressants, In antidepressants, tricyclic antidepressants like nortriptyline, amitriptyline can be used as a painkiller that you people have to read, right? So painkillers are important, and in autocoids topic, NSAID is a topic that is used as a painkiller. So NSAIDs you people have to read. Now guys, because of unknown reason, the gout has been asked in your exam. So gout treatment they have asked in your exam, especially this medicine, allopurinol they have asked. So allopurinol is a medicine they have asked in your exam 2 or 3 times. So allopurinol is a medicine that we use for gout that you have to read, right? You have to read about the triptans. Triptans are the drugs that we use for migraine. Triptans are the drugs that we use for migraine. So this can be asked in your exam, right? So triptans, gout, and painkillers can be asked. This is the only thing that is important in autocoids. Now, after this autocoids, which topic is left, guys? GIT. So, if we talk about GIT, I hope which topic is most important in GIT? Answer is GERD. So, you people deal with GERD, right? So, GERD drugs are important. So, here the medicines are like proton pump inhibitors, H2 receptor antagonist, histamine 2 receptor antagonist. We have some prokinetic medicines. Prokinetics are important. Prokinetics like the medicines, this you have to find out by yourself. I'm not here to teach you, है ना? So prokinetics can be asked. Second is anti-emetic, vomiting, है ना? Medicines that are given for vomiting. Wow. Medicines given for vomiting, anti-emetics are important. Anti-emetics are very important for your exam. The medicines which are 5-HT3 blocker, medicines which are dopamine 2 blocker, 5-HT3 blocker, dopamine 2 blocker, and even the new group of medicine. Guys, this time in medical side, this question is asked. Neurokinin 1 blocker is a new group of medicines that they can ask in the exam. So neurokinin 1 blocker, very, very important. So these two topics are important in GIT. The topic that you have to ignore, the topic that you have to ignore is diarrhea. So diarrhea you have to ignore, constipation you have to ignore. So constipation is not important, diarrhea is not important. Even the medicines given for peptic ulcer disease, drugs that we use for peptic ulcer disease, not important. So peptic ulcer disease, constipation, diarrhea, not important. GERD and antiemetics are important. Now there is a topic hematology. So topic is hematology. Now this is the ultimate topic for you, right? So here you cannot skip anything. You cannot skip anything. So topics like antiplatelets can be asked. Anticoagulants can be asked. So antiplatelets, anticoagulants, and thrombolytics. Thrombolytics, three topics. Antiplatelets, anticoagulants, thrombolytics. But the best part in your exam is only and only mechanism of action. You are not supposed to read their guidelines or pharmacokinetics. So guidelines not important, their pharmacokinetics is not important. So read about their mechanism of action. Maximum you can read their antidotes. So what are the antidotes that we can use if there is a bleeding? So which antidote we can use if there is a bleeding? That's the only thing that you have to read. Like again, I would say this is not 100% sure. The questions can misfire, but this is on the basis of the last 5-year trend. Like maximum they have asked you the mechanism of action and which antidote we can use for the toxicity. So this is what they have asked. Now after this hematology, the next topic is endocrine. Now in endocrine, uh, unfortunately, this topic is ignored in your last 5-year exams. So, like if you ask me which thing you can read, there is a drug bisphosphonates. Bisphosphonates are the drugs which can have some important side effect on your jaw. Medicine can affect the jaw. Jaw side effect can occur. Bisphosphonate. Which side effect, guys? Bisphosphonates can cause which side effects on the jaw? Right? So jaw side effect and bisphosphonate topic is important. And I hope you maximum you can read diabetes mellitus. I don't know why, but diabetes mellitus is not been asked in your exam very frequently. So this is less important. I would not say you should leave the topic because it's kind of a suicide if you are not reading the diabetes. But in last 5 years, there's hardly any question from diabetes mellitus. So diabetes topic like metformin and all those drugs. So less important topic, uh, diabetes mellitus. Bisphosphonate can be asked. Yes, one topic is thyroid. Drugs for thyroidism, hyperthyroidism. Drugs for hyperthyroidism you can read. Drugs for hyperthyroidism you can read. Not very important topic. Yes, this bisphosphonates can cause osteonecrosis of jaw. Right? So endocrine. Then comes anti-cancer. Now in anti-cancers, you people have to read the common side effects of anti-cancer drugs and how to manage them. Common side effects of anti-cancer drugs, like I'll tell you, the common side effect is nausea and vomiting. How to deal the anti-cancer drug induced vomiting, how to deal with anti-cancer drug induced diarrhea, how to deal with anti-cancer drug induced bone marrow suppression, how to deal with tumor lysis syndrome. So these are the four common side effects caused by the anti-cancer drug, and you people have to read the side effect and how to manage them. How to manage this common side effect caused by anti-cancer drug. Now, apart from that, you people have to read about anti-cancer drug like methotrexate, cisplatin. Methotrexate, cisplatin, you have to read. You have to read about anti-cancer antibiotics. Read about anti-cancer antibiotics. For example, you have to read about mitomycin C. This belongs to same class. Mitomycin C, bleomycin, mitomycin C, and doxorubicin, right? So these three medicines you have to read in detail. Now, apart from that, you have to read about the side effects of some antibiotics, some anti-cancer like cyclophosphamide. You have to read about the side effect of cyclophosphamide and how to manage their side effect. How to manage the side effect of cyclophosphamide. That's it. Yes. So these are the topics which can be asked from anti-cancer drugs. Okay. Now, any other topic is left? Like if we uh, try to recall these topics, ANS we have covered, respiratory we have covered, kidney we have covered, CVS we are done with, GIT is covered, autocoid is done, hemat is done, CNS, yes, general pharma is done, antimicrobial is done, anti-endocrine is done. Yes. So guys, most of the things we people have covered. So this is the whole summary of the pharmacology, like the topics which we have given you. And in case you people have noted down this topic, it's very good. Otherwise, I will tell my staff to make a list of all this topic. I'll share this PDF with you people also, as well as with my staff also, with my technical team. They will make a proper list, like they will write in a proper manner because I know that my handwriting is not very good. So they will make a proper list with a good font and with some beautiful pictures like of Aishwarya Rai or some Shilpa Shetty type photographs they will give you. And then you can keep this PDF with you, and this PDF may be helpful. Okay, one thing is left. Yes, the thing which I'm sorry for that I'm ignoring. In endocrine, one topic I did mention, steroids, side effects of steroids. It's very important, side effects of steroids. So we have skipped this topic. Sorry for that. Side effects of steroids is important. So I'll make this list again for you people in a proper manner. And in case some topic is left, that I will cover, right? Okay, guys, and take care of yourself. Pharma is a subject which is interesting, but the only problem is that drug names are volatile. So concept is very interesting. Like you people fall in love with the pharmacology because you people come to know how to treat the different type of diseases. But the only problem is drug names. So for that, guys, please make mnemonics because without mnemonics, you people cannot recall the names of the drugs in the exam. And with all my wishes, if you have any doubt, you can contact me directly on this WhatsApp number. You can WhatsApp me on if you have any doubt, any query. Plus, guys, I'm with you on the DBMCI Premier group. right? And we have our pharma class, retail pharma class in November. Before, I think before your exam, not in November, before your uh, INSCT exam, we have this pharma class in detail. So guys, try to take the maximum advantage of this class, and with all wishes and all love, take care of yourself, and all the best for your exam. Bye guys.